much for allowing us to participate here today with you guys. I'm very excited to share a little bit of my story because I was diagnosed in 2009, and I mean, I'll get to that eventually, but it's quite a long story, so I'm trying to shorten it up a little bit. It's just, I'm getting used to telling it, and poor Michelle has had to hear it, I don't know how many times, but she says I get it a little bit different every time, so. So here's my roadmap. So in August of 2025, I was on vacation at our family cabin in Saskatchewan, and I started losing the feeling in my toes. And within 3 days, I had that numb, tingling sensation all the way up to my hip. So I was going home, so I went home, and I thought I better go to emergency just to see what's going on. Went to emergency, and yeah, they tested me for diabetes and sent me home and said, maybe you should see a neurologist. So I called my GP, who has been my blessing throughout this whole journey. I have to tell you, he's stuck with me. He's not allowed to retire till I'm in the ground. And he's the same age as me, so he's gonna be working a long time, I hope. But he referred me to a neurologist. I wasn't gonna be able to get in to see the neurologist for 2 months. So put me on a cancellation list. So that Friday, I got a call and said, yeah, we've got an opening, can you come in? I said, yes, I'm coming. So I went and saw this lovely neurologist who did some testing about, my sensation and my muscle strength and everything else. Went out, came back in and said, you're coming with me, we're going to the hospital. He walked me across the street to the Royal Alex Hospital. Left all of his other patients behind. It scared the crap out of me. And so because I had metal implants in my ears, and one of them they couldn't confirm. They had to do what they call a myelogram. So that was not my favorite test ever, where you've got to have dye injected into your spine, keep your head forward so that it doesn't come up into your brain. And they couldn't find any lesions. They thought because he had said to me, you've either had a stroke, you have cancer, or I can't remember what the third one was because it was just all a fog, but anyhow, and then, so he says, no, we think you might have MS. Can't see any lesions. So he's treating me on hydrosteroids. And I don't know if you've ever heard like postural headaches, like once you've had a poke in your spinal column and stuff like that. I guess he didn't put enough compression on me afterwards. So the only way I was comfortable was laying flat on my back. And I'm having to sit in an IV chair getting my hydrosteroids. I mean, I cried for 4 days, and then I cried for another 3 weeks afterwards because I had to lay on the ground. I went to work and laid on the ground. I'd get up at my desk, do some stuff, and then I'd lay on the ground for a little while, get back up, do some stuff. So anyhow, we started this whole journey. I joined the MS Society. Got some wonderful supports there. So I mean, I was sold on support groups right out of the gate. They were wonderful, wonderful, helpful people. But I was so tired, I couldn't hardly walk. My blood work was good. Nothing was showing up anywhere. So finally, doing all kinds of things. And so 4 years later, I just looked at him and I said, I can't keep going like this. I just can't. Can we repeat some of those tests and see if there's any change from what you saw 4 years ago? So, I didn't have to do the myelogram, but I did have to do a spinal tap, and I got the postural headaches again. So, but yeah, he says, now we think you might have MGUS, so that lovely monoclonal gammopathy of undetermined significance, which is a really long way of saying they have no freaking clue. And so he referred me to a hematologist, and this man was absolutely lovely. I think he had his suspicions, and so he did a bone marrow biopsy. It was inconclusive. He was going away to Africa for the summer to work, and he said, I'm going to refer you to the Cross for a PET scan to see if we can find anything in there. So, I mean, I did some of my Google research, which you shouldn't really do ever when you're suspecting something, but I did find something that tied MGUS to myeloma, and I thought, yeah, that's probably what I have. And sure enough, I went for my PET scan, went to the Cross to get my results. Dr. Belch, who was absolutely amazing, says, oh, your ribcage lit up like a Christmas tree. You have myeloma. And not knowing what that was, but knowing I'm at a cancer center, I know it's probably not good news, but I was like, yes. Because now I had an answer. I knew that they knew what was wrong with me. It was just determining what the action plan would be. And he says, yeah, let's monitor you for a little while, because, you know, you're healthy, you look good. I mean, I was only 47 at the time. And I said, no, I've been monitored for 4 years. I need a plan. I need to know where I'm going next. So he did another bone marrow biopsy, which also came back inconclusive. And he told me about the raisin bread. He says, so if you're being asked to take a blood sample and determine whether or not it's regular bread or raisin bread, unless you hit a raisin, you're not gonna know. So he says, we're not hitting any raisins. But based on your rib cage, the lesions there, he says, we're gonna make this your diagnosis. I said, okay. So I started and had my stem cell transplant in May of 2010. I was very lucky to be young enough that I was on the kids plan, I guess is what they called it. So I was out of the hospital within about 10 days. Usually it's a 2 to 3 week stay. So I was happy. I just kept telling them, get me out of here. I gotta get out of here. This is nuts. I'm going crazy. So I finally got out. My children were in their early, well, one was just 19, the other one was 24 when I had my diagnosis. The hardest part was telling my mom and dad, actually, because nobody wants to tell their parents that you've got an incurable cancer. So when I phoned them, I said, okay, Dad, because they live in Regina, I'm here. Do not look this up on the internet. But when you do, please go to this site, because the doctor gave me the Myeloma Canada site, which was like absolutely awesome. So it's great that he promoted now Myeloma Canada right out of the gate. So I said, okay, so you go to this site, but don't look at the statistics. But when you do look at those statistics, please remember that your daughter is not average. So, so I don't worry about anything because my dad does it all for me. He's my worrier, so I get to just, okay, something's going on, my dad will worry about it, I don't have to, right? For my induction therapy, it started with high-dose dexamethasone. I ended up with pneumonia, broke a rib coughing, decided to have a bath because it was a really, really cold day, got in the tub and realized what a huge mistake that was, because now I'm not going to get out of this bathtub because it hurt so bad sitting there with this broken rib. So then I'm thinking, how am I getting out of the tub? And then I started to giggle because I'm thinking, oh my God, I'm gonna have to get my 24-year-old son to come haul his wet, naked mother out of the tub. And it just struck my funny bone, so I started to laugh. And I laughed so hard I started to cry, and I thought, okay, well this can't hurt any worse. So I went over the side of the tub, and that was it for bathing for me. So I stopped bathing after that. But I try and find humor where I can, I guess, is what I'm trying to say, is because I'd rather laugh. So yeah, so then I started with, I had my stem cell transplant. I had a very good remission. I had thalidomide maintenance on compassionate access, because at the time of my diagnosis, some of these drugs were not available except on a clinical trial and in a relapse setting. Well, I was brand new, so I had no relapse setting. So I was on thalidomide, had good sleeps for a few years. It was awesome. The only thing is I had to go for pregnancy tests every month. So like, and not just a pee in a cup, they actually wanted blood work to prove that I wasn't pregnant. So in July of 2013, I broke a rib planting flowers. And that was the start of finding out that I was relapsing. So I had to have some radiation, which I call spot welding. And by 2013, my M protein had gone up to a 1. And so I was put on Revlimid and dexamethasone. And I had some hip pain that just started up right away, but it was like, nah, it's not the myeloma. It's something else. Oops, sorry. I need to go backwards. There we go. I shouldn't touch this. So yeah, so the Revlimid and the Dex took me back to 0 for my M protein. What we didn't know at the time is that I was becoming oligosecretory, which meant that my M protein wasn't a really good monitor of how my disease was doing. So by the time it got up to a 1 or a 2, serious stuff was happening inside. So I had to teach my doctor that I was unique. And you talk about self-advocacy, Michelle was talking about that, you really do have to learn how to speak up and listen to your body, and also like these experts, they're wonderful, but they're not experts about me. They might know a lot about the disease, but they don't know me yet. So they're learning, they're still learning. I had an MRI ordered for the hip pain, and it's like, okay, you've got some lesions in your pelvic area, so I had some more radiation. The pain subsided a little bit. By 2014, I was considered in remission or having stable disease control. I had the DEX removed because I kept getting persistent skin infections, so I'd have to go and get like these lesions drained and packed on a daily basis. It was just absolutely horrible. I was referred to the pain clinic in May of 2015 and put on gabapentin and different things, trying to figure out what was going to help, and it just wasn't doing anything for me. And then in September of 2015, I just couldn't stand it anymore. I went to the ER, and they said, no, you're not going home. You're about to break. So, well, I have to go home. My car is here. He says, you can't. I said, well, I'm going to. He says, well, you can't unless we get you, promise you won't put any weight on your leg. Because I was just in a little community hospital. It was no, like, real, I guess it's more like a patient care center. He says, well, you can't go unless you promise not to put any weight on your leg, and we have to have an appointment with an orthopedic surgeon for you before you can go. So fine. So they sent me to the Royal Alex the next morning. So I went first thing in the morning, got my friend to drive me, kept my promise, didn't put any weight on the leg. I had crutches at home. And so he looked at my x-rays, and he looked at me and says, yeah, you need somebody better than me to look after you. And so then he sent me to Misericordia Hospital to see an orthopedic tumor specialist. And he says, yeah, you're staying, we're keeping you, and we're going to do surgery tomorrow because the neck of your femur is like a credit card that you bend back and forth until it breaks. He says, that's where you're at, you're gonna break. So I got nailed by a really cute young doctor, so that's what they call it. Put a nail in my femur. So yeah, so it was interesting. So again, finding the humor. And so in November of 2016, I was in the ER because I had spent 4 weekends in a row traveling for Myeloma Canada. Love you, Myeloma Canada. Not blaming you at all. But I had gone to the Family Medicine Forum, I had gone to the Scientific Roundtable, I had gone to, Support Group Leader Summit, and then there was another event, in Toronto. It was something to do with, it was a conference for connecting people through social media. Anyhow, it was yeah, so it was 4 weekends in a row, and I mean, I'm working full-time still. So this is my volunteer job and my work job. So I thought I was just exhausted. And so I had pain in my lower back and it just wasn't stopping, it got worse. So back to the hospital I go. And they say, yeah, we're gonna send you to the Royal Alex for an ultrasound because we think you've got kidney stones. So, okay, I've got kidney stones, that's manageable. Because you just don't know with this disease. What's aging? What's disease, what's something else entirely. And so, yeah, ultrasound comes back and I've got a 7-centimeter plasmacytoma on my pelvic floor that was blocking the ureter, so I was kind of hooped. So again, now my M protein is back up to a 1. So I have radiation for the plasmacytoma. And so, by that time, Dr. Belch finally figured out that, yeah, okay, they're never gonna find the raisin with me, so, like, we need to act when I say it's time to do something. They have to listen to me, they have to know that I'm different. And that's when they gave me the oligosecretory word. And Michelle was talking about language. Like, when I was going through this initially, House, I don't know if you guys remember the TV series House, right? It was quite popular then, I watched it, I remember that. I've had that done. Ooh, that sounds interesting. I should ask the doctor about that, right? So it was, yeah, it was a lot of fun learning this new language. So, daratumumab was just available on compassionate access at that time. And so rather than having a second stem cell transplant, Dr. Belch decided he wanted to put me on the daratumumab because my window was closing. I might not be able to access it. So he gave me daratumumab, Pomalyst, and then Lero, which is ixazomib. So like all of these words, I know them. It's like phosphomide. I can say them easily now. It's ridiculous. And so we added an annual PET scan to my monitor my disease stability, and he told me I was now 2 brand new Ferraris a year. So I'm grateful that I've had access to the things that I've needed when I've needed them. So yeah, so 2017, I'm like, okay. My treatment got suspended because I was down in the US having a visit with my mom and dad. My mom and dad are snowbirds. I ended up with pneumonia and 2.5 weeks in the hospital, got maybe back to home, another week and a half in the hospital here, and yeah, thank God for my travel insurance. I gotta tell you, I was so lucky that everything was just, I was well taken care of. I really was well taken care of. So my M protein went back up to a 1, but the PET scan showed that I had a little plasmacytoma in my butt, but there was nothing big enough for them to do anything about it. And then I went back down to 0, and I ended up having a radiation on that little spot. I had another spot weld on my backside. So yeah, I mean, this is a lot of ups and downs between 2005 and 2017, but I've kind of plateaued now. So I've been taken off of the Pomalyst and the Nimlero over time. The Dex is gone, thank goodness. I hate dexamethasone. And I never got the high. Everybody talks about this high and they get all this housework done. I'm just like, are you kidding me? Why can't I have that? My house would have been so much cleaner. So yeah, so now 2017 to now I'm living and loving life. You know, I've gotten to welcome critters and spend time with my grandma and aunties, and I got to travel to France, my first time ever overseas. It was absolutely spectacular. Honorary grandkids, and for real grandkids, I get to volunteer. I mean, that's I've been active with Myeloma Canada since 2009, and with the local support group since the same time. I've been on the board for this support group in different capacities, and thank goodness this year I'm the treasurer now, but I get to pass that off because I'm going to be vice chair at Myeloma Canada, and I can't do that many volunteer things at that level. So, I mean, obviously I'll stay active in all the groups. I've been able to work with the Cure Cancer Foundation as well. I don't know if anybody has heard of them. They're a local, I think they're Alberta based. I think they started in Edmonton. I think they've branched out, but they do a lot of work with Dr. Michael Chu to help him get his lab going for creating CAR T cells. So he's like Michelle said, these brilliant minds that do all of these wonderful things because it's their passion, and I'm so grateful that it is their passion. Again, welcoming more grandkids, spending time with my friend in Nova Scotia who was a smolderer for many, many years, but finally caught fire, I guess if you want to call it that. And so she started her treatment a year and a half ago. And I was fortunate enough to be able to be there as she started it and spend time with her. And so we made soups and cookies and stuff to throw in their freezer so that they would have stuff when she wasn't feeling up to snuff. And then, I mean, I got my parents there with their great-grandson, my daughter and her wife. I call them turkey baster babies because they have done it themselves. They got their own donor, and yeah, they made me one baby, and I've got another one on the way in August. So I'm very excited. I just absolutely love them. I mean, they just bring so much joy, And yeah, my little, you know, the little guy in the center there with the phone, I just love that picture because it's like low tech is now high tech. It's just fascinating for him, right? at my mom and dad's, he found an adding machine, and so the tape rolling and the click, 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 click. Oh, he just absolutely loves it. So yeah, so I guess, basically what it comes down to now is this favorite quote of mine, and I don't know who to attribute it to, but on particularly rough days when I'm sure I can't possibly endure, I like to remind myself that my track record for getting through bad days so far is 100%, and that's pretty good. And then my personal mantra is stable disease control with minimal side effects. I want to continue living my good life. And that's my story. Thank you.